Hello and welcome. Today, we're going to dive into a really important health topic. It's something that affects millions of men, but, it's often surrounded by a lot of silence. We're talking about erectile dysfunction, and we're going to look at it in a new way, not just as a condition, but as a potential key indicator of your overall health. So, let's get right into it.
We're kicking things off with this question because honestly, it gets right to the heart of what we're talking about today. The answer? Well, it might just surprise you, and it could be one of the most important things you learn about your health for a long time.
So here's our game plan. We'll start with the basics. What exactly is ED? Then we'll explore why it happens and uncover its huge connection to your wider health. And then we'll walk through the practical stuff, how to get help, and what the treatments actually look like.
All right, first things first. Before we can really get into the why or the what it means, we need a super clear and simple definition, so we're all on the same page. Okay, so here's the clinical definition. It's really important to know we're not talking about occasional difficulties. That can happen to anyone. We're talking about a persistent, ongoing problem. And most importantly, it's a recognized medical condition, not some kind of personal failing.
And when you look at the numbers, it's pretty eye-opening just how common this becomes over time. I mean, sure, a smaller percentage of men in their 40s are affected, but that number just shoots up with each decade. By age 70, you're looking at more than half of all men. The biggest thing to take away from this is simple. If this is something you're going through, you are absolutely not alone, not by a long shot.
So what's actually behind it? Well, the causes are often a mix of things, usually involving a combination of physical and even psychological factors. Let's break those down.
This list is pretty telling, isn't it? A lot of these risk factors are the exact same things that impact our overall health. Stuff like not getting enough exercise, smoking, and really common conditions like diabetes and high blood pressure. This right here is our first major clue that ED is tied to something much bigger.
We can't forget about the powerful mind-body connection here. Psychological stuff like stress, performance anxiety, or issues in a relationship can definitely be a primary cause, or they can make an existing physical issue even worse. It's almost never just one or the other.
But most of the time, there is an underlying physical or organic cause. Problems with blood flow, with nerve signals, or with hormones are the most common culprits. And this is what leads us to what I think is the most critical part of this whole discussion.
Okay, we've arrived at the most important takeaway. Seriously, if you remember only one thing from all of this, let it be this. Erectile dysfunction can be a critical, early warning sign for cardiovascular disease.
I mean, just read that. This statement from a huge paper in the Lancet is incredibly powerful. It completely reframes ED. It's no longer just a quality of life issue, it's a potential lifesaver. It's your body sending up a flare, a signal that something deeper needs your attention.
So, why does ED show up first?
Well, this picture explains it perfectly. Think of it like plumbing. The arteries that supply the penis are tiny, about half the size of the ones that supply your heart. So the same amount of plaque buildup that might only slightly narrow a heart artery could completely block one of these smaller arteries, causing symptoms of ED way earlier.
Think about that for a second. 2 to 3 years. That's not just a warning sign. That is a window of opportunity. It's a chance to make changes, to talk to a doctor, and to potentially prevent a much more serious health crisis down the road.
Okay, so the message is clear. Now what? What do you do about it? Well, the next step is all about taking action, and I promise it's simpler than you might think.
So when you go talk to a doctor, this is pretty much what you can expect. They'll just talk with you, get your medical and sexual history, do a focused physical exam, and probably run some basic blood tests. The goal is to figure out the cause and, just as important, to check on your overall cardiovascular risk.
And that's really the bottom line. That conversation with your doctor isn't just about sexual health. It's a full-on health check-in. It's about being proactive and taking that early warning sign seriously.
Now for the really good news, ED is very treatable. There are a ton of effective options out there, and the approach is usually customized just for you.
Doctors usually have a step-by-step plan. They'll start with the least invasive things, like making lifestyle changes and trying oral pills. If those don't quite do the trick, they can move to second-line therapies. And finally, there are even surgical options available as a third line. There is a clear path to finding a solution that works.
All right, so those oral medications, which are called PDE5 inhibitors, are the most common first step. You've probably heard of them. These pills basically work by increasing blood flow.
And as you can see, different drugs like sildenafil or tadalafil work a little differently. Some kick in faster and some last a lot longer, from a few hours to over a day. This lets you and your doctor find the one that fits your life best, and for a lot of men, they work incredibly well.
And this part is absolutely key. The medication works best when you also make the same lifestyle changes that protect your heart. Losing weight, exercising more, quitting smoking, these things don't just help your erections, they improve your entire health. They get to the root cause of the problem.
So if we boil this entire thing down, these are the 3 things to remember. 1, it's common, so there's absolutely no reason to feel shame. 2, it's treatable, so there's every reason for hope. And 3, most importantly, it's a vital health signal that you really shouldn't ignore.
So, we end right where we started, but hopefully with a brand new perspective. The real question is, what is your body trying to tell you? Because listening to it might just be one of the most powerful things you can do for your long-term health. Thanks for joining me.